Good afternoon, Dr. Bandikatla. As always, it's such a pleasure to be here with you and talk to you about the topic. Before we get into the topic, uh, why don't you introduce yourself and tell us and tell the audience a little bit about you and your practice?
Thank you very much. Thank you very much for inviting me. I am Dr. Vijay Bandikatla. I am founder director of Indo British Advanced Pain Clinic. We are here at road number 12, Banjara Hills, Hyderabad, in India. Started this clinic after coming back from the UK, where I practiced in Bradford Teaching Hospital as a consultant pain physician. My training in pain involves advanced pain training in Cambridge, and then I did my fellowship in neuromodulation at Guy's and Thomas's London, and then I practiced for a while. So yeah, all in all, my journey in India has been very good. So I get to introduce to lots of new technologies, something like Verity that I'm using right now. So we've set up this and we're running it well.
Thank you. And we at Verity, and I'm sure a lot of others and all of your patients are glad that you are doing what you're doing, and we need more of Dr. Bandikatlas in India. The way things are going. Talking about pain and your patients, tell us, the frustrations that you have with conventional treatments, right? And we can elaborate on how these challenges have impacted your practice.
Pain is a very abstract topic, honestly speaking. The problem with pain is you can't measure it in a very objective way. Most of the times you have to believe in what the patient says, and that's where the big problem comes. Sometimes you get to a point where you doubt yourself and you start doubting the patient that they're giving you the right kind of information to you. These are the problems, and particularly when it comes to places where you are unable to diagnose the problem and treat it in an appropriate way, the patient's frustrations are actually adding on to the problem. For example, patient who has got a lumbar back pain, so it's very difficult at times to precisely say where the problem is. It could be into the spine, it could be the disc, it could be the facet joint or a nerve compression, or maybe even a simple muscle spasm which is causing the problem. So none of the tests will tell you what exactly is the problem. So this adds a lot of frustration to any clinician. And then most of the medicines that we have, they've got a very limited role. So sometimes, if you see most of the medicines that we are using, some of them are anticonvulsants. There are some things which will reduce your epilepsy, but that we are using it for pain control. Some of them are for reducing depression. We are using them for pain. And then we have these narcotics. They come with a huge set of problems. So none of it is coming easy. And then we take them for interventions, various needle-based procedures. They also have their own problems at times. So we take through all of these things when it is required. But sometimes the problem is not just at a very peripheral biological level. There's a lot more at the psychological level up there. So there can be some inhibition which comes within the patient. This, what we put it in the medical knowledge as neuroplasticity. So there is some hard wiring which changes within the patient's brain, and they just can't go any further. So there might be issues like anxiety. There is some lot of fear which goes on to the patient. They don't want to move, and then these kind of complex situation where there is psychological component along with some biological and the other social components which add to the patient, it becomes so difficult to untangle these things, and that is where technologies like these will become a huge bonus to us.
Yeah, I mean, it is just amazing to hear that anticonvulsants and antidepressant medication, they're being used to treat pain. And that gives somebody and everybody a sense of how complex pain is. So how do you deal with even after multiple attempts at treating a patient and getting them past that fear avoidance that stage? When you're still frustrated and there's no progress, how are you today dealing with those situations?
Generally, we follow what is called as a multimodal approach. So we use various kinds of medications, we use the interventions and various therapies that we add in. So when only required, we refer them for a surgery. So we put all these things together, and that has been our traditional way of treating patients. In spite of all of these things, there are a significant chunk of patients who do not get adequate response. So that is when we will require these kind of technologies where most of these things are acting at the spinal and the musculoskeletal level. So when it comes to changing the patient's perception, we need newer technologies, and that has not been explored so far, and that's what Verity has been doing.
That is a great segue because that is precisely why the relative ineffectiveness of some of these treatment modalities that we have today. That was our angle. We said, hey, what else is out there? How can we bring in technology, virtual reality, AI to move the needle on this front? And it is really exciting for us to know that you're actually using our technology to fill this gap. Why don't you tell us about how you're actually using Verity and how it's been going with our technology?
The way I see this new technology is brain has got this incredible capacity to change its perception, both in terms of general activities as well as with pain. So we call it as neuroplasticity, as I mentioned. So the brain will change its sensitivity. So we call it as a central sensitization and peripheral sensitization. These are the terms that we generally tend to use. So if the impulses of pain are repeatedly coming on to the patient, so your sensitivity to pain is increased. So you will start to perceive more of this pain. So that is something which is changing in the hardwiring. If there is some treatment which is allowing you to reduce that, that's what we're trying to do with all the anticonvulsant, antidepressant drugs. We're trying to reduce that, but then they come with their own side effects. So what we are trying to do, I'm very excited about using this technology because without the usage of these medicines or even the interventions, we are able to change the perceptions of the patients when they have this increased sensitivity towards their pain. So that is where the mindfulness things that we've seen on this and various other physiotherapy modalities that we are seeing, the therapy modalities and even the pain management programs, they take the patient into a virtual world, and then in the gameplay they're actually changing their activity levels, and then it is actually showing it back to the patient that you are able to perform. So that's incredible. So that's something which is really exciting me to use this on more and more patients now.
It's fantastic, and it excites me to learn that you're beginning to use it on more and more patients. Do you have a recent example that you would care to share with us?
So first thing is we started using it in lumbar back pain patients, and gradually for neck pain patients, and then we started using it for shoulder pain, the frozen shoulder patients. So there is a component of fear and apprehension which is stopping them from moving. Of course, they have a mechanical component which is fixing their joint so that they are unable to move. But then we do some treatment to open it up, and then they're able to move it when they are under anesthesia. But then when they come awake, so they've got this apprehension of moving it. So I'm really excited in using this on my patients who had already the shoulder which is mobilized, the manipulation that we do. Once that is done, if they still have got that movement when you apply this technology, so they're able to give good movements. I can share some videos, and it was really exciting for patients to be able to do that. And we're just breaking their apprehension barrier, and then they're able to participate in their further rehabilitation. So that way, it is actually avoiding them to go through further capsulotomy, capsulectomy surgeries to open it up.
Oh, that's fantastic. I mean, that just brings a smile on my face. What was the patient's reaction like? When they saw what was happening, how did they respond to it?
It has been very excited both from the patients and some of the other colleagues who have seen. Even in child psychiatry, we have seen that. For autism, ADHD patients, we've seen that. We've seen it in other specialties. So we see, at least I am seeing a big role for it in everyday clinical care. We should be able to use it in multiple ways in future.
Apart from what you're doing with Verity today, where do you see the future going? What are your thoughts about how you would like to use Verity in the future, and what should we do to make that happen for you?
As a clinician, I see a very bright future for the technology, how it is going to affect us. Actually, if you see, most of the times we are only doing some subjective assessments. So I go examine my patient and write down a few lines here. But if I really want to have some objective assessment of how that patient is, I either do not have the time to do it, or I don't have the manpower who can do it in a proper way, and the cost constraints. This technology, what I'm seeing is, as it is being developed, we'll be able to, or we should be able to get all the range of motion. These kind of things can easily be assessed, and that's what we are working with right now. So this actually will change the way how we are going to deliver our care to the patients in future. And we will have this objective assessment, the range of motion, all the gait analysis. These can be performed in a proper way, and they can also be done on multiple visits as they are coming, and their progress can be plotted. This will be a great thing for the patient to track their progress, and it's there on a paper. They can actually say, take home, and then discuss with another doctor, and he will also know exactly how his treatment is progressing. So there's a lot of continuity of care which comes along with this. So I see there is a very good role for wearable technology in future in medicine.
No, that is awesome. Since you talked about the measurement piece, right, and showing progress to the patient, one thing that's very unique is it is consistent. It's not two humans trying to take the measurement.
Yes.
It is a computer, an artificial intelligence, and a system, and so it's going to give the same consistent results. And that's what is exciting about this from our perspective. We see huge potential here, and we are driven by the passion to help you help improve the lives of your patients. Right, so that's what keeps us going. Once again, fantastic talking to you today. Thank you for spending this time and talking to us about how things have been going there at your clinic.
Thank you. Thank you very much.